simu namba 0727 00 6530 kana 0725 89 43 48. Inyuothe muri anyite ogeni.
Welcome to the very first episode of Medi-Camp Health Show. I am going to be your host, Mumbi Mavuti. Now, every October we observe the Breast Cancer Awareness Month. Today we are at Outspan Medical Hospital, where we are going to be engaging specialists who will help us break down breast cancer for you. Welcome, stay tuned, and remember to interact with us on our Facebook page, GTN TV Kenya. Send in your comments, ask any question, it's going to be answered. Thank you so much for tuning in. We are live at the Outspan Hospital, and joining me for this episode is Serafina Gishohi, who will be taking us through this. Remember to interact with us on our Facebook page, GTN TV Kenya. Be sure to send in your comments. Any question that you have is going to be answered. Thank you so much for joining us. Thank you for creating time for us. Karibu sana.
Asante sana.
Yeah, if you could introduce yourself to the viewer.
Okay, my name is Serafina Gishohi. I'm a palliative care nurse at the Outspan Teaching and Referral Hospital.
Thank you. So today we are here to talk about breast cancer. According to statistics, in the last 1 year, in Nyeri County, we've registered around 509 cases, if that is right. What is cancer? What is breast cancer to start with?
Breast cancer is a tumor that grows in the breast. It either grows in the breast tissue itself or in the duct. That is the milk duct. Yes.
Does it only happen in women?
No, it happens in both men and females as well. But for men, it only affects only 10% of the males. Yes.
Okay, and what could be some of the risk factors? Why are people, we understand that there isn't an exact cause for cancer, any type of cancer, but what could be some of the risk factors for breast cancer?
Okay, some of the risk factors for breast cancer is age. Although these days we are seeing a lot of young people also developing breast cancer, age is a risk factor because the more you age, the more you are prone to developing cancer. The other risk factor is obesity. If you are overweight, you also have a risk of developing breast cancer. If you are using hormonal therapy, hormones predispose somebody to developing breast cancer. Whether they're in form of contraceptives or any type of therapy, you are at risk. The other risk factor is genetic. You can develop breast cancer because of genes. If there is a history of cancer in your family, especially breast cancer, then because breast cancer lands in families, you can also you have a chance of developing breast cancer. The other risk factor is inactivity. You know, that's why people are taught to be very active, to do exercises, because inactivity also is a risk factor. Yeah, those are some of the risk factors.
Mostly when someone is diagnosed with breast cancer or any other type of cancer for that matter, they are told you're either in stage 0, 1, 2, up to 4. What exactly do these stages mean?
Okay, these stages define the extent of how far the breast cancer has gone. If stage 0, it just affects the duct. It's what we call as ductal carcinoma. It's just in the duct. In stage 1, it's in the breast tissue itself. And it is around 2 centimeters, but but has not gone very far. It's just within the breast. Then from stage 2 to 4, the breast, the cancer has now gone beyond it, either to the lymph nodes or to other distant organs. Especially in stage 4, it has already gone to other distant organs like the bones, like the lungs and the brain. Yes.
And before we go to treatment based on the various stages of cancer, is it possible to have someone, especially a lady, who is below the puberty age, say 12 years old, diagnosed with breast cancer?
Well, at that particular age, below 12, is a bit rare. If there is a breast lump in such a lady, it's most likely benign. Because not all tumors or not all lumps in the breast are malignant, are cancerous. There are some that we call as benign tumors that occur in young girls because of the hormones, because of the hormonal estrogen at that particular age. Yes.
What are some of the symptoms for someone who is back there at home? What are some of the body changes or something that will alert them? Maybe they have cancer, maybe they need to visit a health facility.
Okay. First of all, we tell women to know how their breasts look like. You look at yourself in the mirror and you exactly study your breast and know how they look like. Normally, breasts, one is slightly larger than the other one. They are not symmetrical. Then you'll find, now when changes starts coming in your breast, you'll definitely see those changes. When you look at yourself on the mirror, you may find some discoloration on the skin, maybe some swellings. When you press on the nipple, you may find there is some liquid coming out or some blood coming out. When you palpate the breast, you might feel some lump. But as I said, not all lumps are cancerous. There are some that are benign. They are removed and they don't spread to in other organs. Yes, those are some of the signs. Then when you touch your axilla, you'll also find some swelling around the axilla. Because breast cancer spreads through the lymphatic system. So those are the lymph nodes that you find in the axilla. You may also find that they are swollen. Yeah, so those are some of the signs.
When you talk about a benign lump, you mean one that is not cancerous?
Yeah, one that is not cancerous. It's an innocent tumor and it doesn't spread.
Okay. Yeah. We've had a lot of correlation with nutrition, what you're feeding in, the kind of a lifestyle you are leading, and cancer. Exactly what type of nutrition, what kind of a lifestyle should we adapt if at all we are going to prevent cancer?
Okay, what we advise people is to adopt a very healthy lifestyle, especially in terms of nutrition, in taking a whole grain meal. Not refined foods. Refined foods predispose somebody to so many conditions, not just cancer, but even other conditions like diabetes and hypertension. So if they take whole grain meal, that will help them even in digestion. And then they take low fat diet, and low lavage and high lavage diet. Yes, a lot of fruits, a lot of vegetables. That is very important. And also milk should be low fat, because milk has a lot of fat. And therefore we advise them to take low fat milk as well.
Low fat milk, what do you mean when you say
that the fat has been removed? Yes.
Like the pasture-raised milk we get in the shops, but the one that is...
Yeah, there is, even in the supermarket, there are milk that are written low fat.
Oh.
Yeah, yes, they are there that are written low fat. Yes.
What about lifestyle? Is there a correlation between the way we lead our lifestyles, exercise, maybe drinking alcohol? Is there a correlation between these habits that we have and cancer?
Yes, exactly. There is a correlation between the lifestyle, the life that we lead these days of inactivity. People are not doing exercise. People are eating a lot of junk food that are high in fat. All this predisposes them to developing cancer. Another thing is alcohol. The people are taking a lot of alcohol these days. Smoking, all this will predispose the person to developing cancer. Yes.
Now, when we talk of cancer treatment, we've heard about chemo, we've heard about surgery, we've heard even about radiotherapy. What determines what treatment that a cancer patient is going to undertake?
Okay, the treatment of cancer is determined by the stage and the grade of the cancer and the type of cancer that you are having. There are cancers that are very aggressive, that they spread very, very fast. So the doctor will decide what type of treatment depending on what stage you present. For example, in breast cancer, if you come in stage 0, you are most likely going to be cured because you will be done surgery, the breast will be removed, and then the patient is put on hormonal therapy without undergoing chemotherapy because they're in stage 0. But now when it comes to stage 1 to stage 4, somebody will now have to be done surgery, that is mastectomy, removal of the breast, and then will be done chemotherapy. They will be done radiotherapy as well. And if their tumor was hormonal resistant, hormonal response status was positive, they also be put on hormonal therapy. Yes. So
when you're talking about breast cancer, is it that mastectomy or removal of the breast, is it the end result, or is there something else that could be done such that a woman does not have to, the breast doesn't have to be removed?
Okay, there is something else that we call as lumpectomy, removal of that lump. But most of the doctors, to be on the safe side, they prefer removing the breast, and they even advise the client. But then, you know, it's an informed decision. The client now will make the decision. Do we remove the lump? Do we remove the breast? But most of the doctors prefer removing the whole breast so that the cancer does not recur. Yes. And
after mastectomy, is there a possibility of reconstruction surgery? And if yes, is it safe, or is it going to again raise the risk of cancer reoccurring?
Okay, for cancer, you cannot be guaranteed that it will not come back. It can come back, and it can come back even to the other breast that was not removed. For cosmetic reasons, some of the doctors do reconstructive surgery. They can do that. On the other hand, we also have breast prosthesis that we advise the clients to be putting on, so that they look like, you know, the same way that they were looking before mastectomy was done. So we have breast prosthesis. That is another option where the lady can be putting on that one. Yes.
Do we have a chance at preventing cancer? Is cancer preventable in any way?
Okay, there are some cancers that can be prevented. For example, if measures are taken, if people change their lifestyle, measures are taken to improve the environment, and for people to understand the need for proper nutrition, the need for doing exercises to lower their weight, it can be prevented. And so many other things that people need to adopt. About use of chemicals that we use even in our farms, people can prevent that. Or they can also use protection when they are using those chemicals. If it is maize, it should be dried properly because of aflatoxin that affects and causes liver cancer. There are so many things that can be done to prevent. So we always tell people to do what they can do, and then God will do the rest. Yes.
As a palliative care nurse, how should we live with people living with this disease, people living with cancer back at home? For some people, they can't even afford to take them to facilities where they'll be taken care of, and they have to live with them at their homes. How do we handle them? How do we take care of them?
Okay, for our patients who are having this chronic illnesses, or in other words, now we are calling them life-threatening illnesses. We need to take charge of taking care of them, because first of all, they need a lot of physical care, they need psychosocial care, they need spiritual care, and they need emotional care as well, because they get affected because of these conditions. And therefore, they can be admitted in hospital for them to be stabilized. Once they are stable, they can be taken care of at home, what we call as home-based care. And the family can take charge of taking care of them, giving them drugs as they have been prescribed by the doctor. Most of them have a lot of pain, so they are, we advise them to give them pain drugs so that they live without pain. They live without any other distressing symptoms, because they also have a lot of distressing symptoms because of the disease itself. Because of the chemotherapy they are also going through, it also causes quite a bit of side effects. So as medical people, we take care of those side effects so that the patient lives comfortable and free from those side effects, so that even if they have to die, they die a peaceful death, or what we call as a good death. Yes.
Yeah, Dr. as we wind up, what is your call to the people? What is your call to the masses?
Okay, my call to people is to try as much as possible to prevent or to avoid those issues that are bringing out cancer, because there are some we can prevent, others we cannot. And then my biggest call is to people to go for checkup. Yeah. For example, like here in Outspan, we do a lot of checkup. If you come, we'll check you out and see what you could be suffering from. So because it's very, very important to have cancer diagnosed early. If you are diagnosed early, you are cured. Yes. Yes. So it's important to be done screening. Yes.
Thank you so much, Madam Serafina, for making time for us. I'll see you in our next segment as we talk about chemo. We are going to see a demo of how chemo is actually done and see for how long it's done, and more about chemo coming. Stay tuned.
Muciari ehe mubango waku ni uriku kuri mwana ira atiria mathomo ma kirathi gia kanana ndugatangike ringi kuona ngwataniro ya hujio thaya ni murakomithiri gwakorwo no heani wa motaro na gutubani kwa mihango yao ya kurua mathomo na motaro maya ni kwambĩrĩria tarĩki 7 ginya tarĩki 17 mweri wa 11 mwaka ũyũ tũrĩ hamwe na marĩa magathomithio na gĩkĩro gĩa kiuma mwana-inĩ nginya mũndũ mũgima gwĩthema ndawa cia kũrebia mĩtugo mĩkindĩrĩku gũtũrana na Ngai ũtongoria gatagatĩ ka mangĩ kwĩyandĩkithia nĩ ciringi 7 maya mothe magatabanio thĩinĩ wa GCTC Center former Othaya Teachers College. Kũhora makĩria hora thimũ namba 0727 006530 kana 0725 894348. Inyuothe mũrĩ anyiti ũgeni.
Kanitha wa ACK St Andrews Kagongo ni urakunyita ũgeni igongona-inĩ rĩa magetha na thutha ũcio harambĩ ya gũteithĩrĩria ũngania wa mbeca cia waki wa multi-pronged income generating community project. Igongona rĩrĩ rigatabanĩrio kanitha-inĩ ũyũ wa ACK St Andrews Kagongo mũthĩ wa kiumia tarĩki 5 mweri-inĩ wa 11 mwaka-inĩ ũyũ thaa 4 cia rũcinĩ. No ũtũme mũcango waku kũgerera Lipa na M-Pesa, business number wĩkĩre 400200, account number nayo wĩkĩre 40058107, na no ũtũkinyĩre kũhĩtũkĩra namba ya thimũ nĩyo 0722 529283. Rathimwo ukiharĩria gukanyitanĩra na ithuĩ.
Muthenya ucio ni tugakorwo na umemerekia wa GTN TV hamwe na aini nguthi. Ni twĩumĩriei ithuothe tugacĩrithie na tukũrie gwitũ.
Akristiano itu o hamwe na arata itu itikirai gukeyumiria muthenya ucio nigetha tunyitirire kanitha witu tuthondeke mieke ya mawira kuri mbeu njiri inyuothe muri anyite ugeni.
Gũtirĩ kĩndũ gĩa bata kuma gĩkĩro-inĩ kĩa mwana gĩgũtuĩka mũndũ mũgima. Nĩkĩo thuri kĩama kĩa mwana ũthaya nĩ marakomithia gũgakorwo na igongona rĩa kũruithia hamwe na kũhe motaro imwana kwambĩrĩria tarĩki 13 nginya tarĩki 24 mweri wa 11 mwaka ũyũ tũrĩ. Maya mothe magakorwo magĩtabanio thĩinĩ wa thukuru wa St. Teresa Kanyange Academy mwana ũthaya. Motaro maya nĩ ta kĩrĩra kĩa ũgima wa mwĩrĩ, motaro megiĩ mũikarĩre mwega, kũharĩrĩrio gũtuĩka ndungata ya bũrũri hamwe na rũrĩrĩ gatagatĩ ka mangĩ. Marĩhi nĩ ciringi 7,500 na kwĩyandĩkithia nĩ ciringi 200 na wĩyandĩkithia nĩ mbere ya tarĩki 10 mweri wa 11. Kũhoro makĩria na kũmenya indo ũgakua hũra thimũ namba 0725 565 498 kana 0721 353 581. O nĩ ũgakorwo na mũcemanio wa tiri hamwe na aciari tarĩki 10 mweri wa 11 kwambĩrĩria thaa 3 cia rũcinĩ. Tũhe kahĩ tũkũhe njamba ya bũrũri.
Welcome back. Like I said, we are going to be here in the chemo or cancer unit at the Outspan Hospital, and joining me is an oncologist. She's going to be introducing herself. Kindly.
My name is Zairine. I'm an oncology nurse. I work here in Outspan Cancer Center.
Thank you so much for making time for us. What is chemotherapy?
Basically, these are drugs that are used systemically here, that are given to patients in the treatment of cancer conditions. And the aim of chemo can be either for cure, it can be used even for palliation purposes, and even for the control of the disease.
We just witnessed constitution of the drugs happening in this room. Could you tell us more about the same?
Yeah, that's basically our chemo reconstitution room, and it has a biosafety cabinet where we ensure that the pharmacists do reconstitute drugs in a safe way without exposing themselves and the environment.
Now, are these drugs administered, or the chemotherapy, is it administered after surgery or before surgery? Because most cancer patients undergo surgery.
Yes, cancer management involves all the, we call them the treatment modalities, the surgery, radio, and even chemo. Not all of them, anyway. But there's some the treatment itself, the chemotherapy, can be given before or after, depending on the cancer and the decisions from the oncologist doctor.
What are the determinants? What will make you be given chemo before surgery, and what will make you get the chemo after the surgery?
One of the aims, we call it neoadjuvant. It's basically to shrink the tumor and make it operable. Yeah.
That is before surgery?
Before surgery. Adjuvant is to kill the microscopic cells. Yeah.
That is after
the surgery.
And at what point does radiotherapy become an option?
it's not an option, but it's also a treatment modality, and basically that depends on the type of cancer and even the decisions that the oncologists make regarding a certain patient.
And for chemo, once a patient starts chemo, how long does chemo administration take? What are the periods? What are the parameters?
Again, these are the cycles that the oncologist prescribes. For example, there are some types of breast cancer where patient initially go to the 4 cycles of chemo, then after they can go for others, depending.
How long does a cycle take? Is it just a one-day clinic? Is it a week long of chemo? How long is one cycle?
21 days.
21 days.
In most cases, yes.
And for breast cancer, it's the same case?
It's the same case.
It doesn't matter if it's a man who is suffering from the breast cancer or it's a woman? It's the same?
Yes.
Okay, and what are some of the side effects of chemo, and how do these cancer patients manage them? How do you help them to manage the side effects?
Different drugs causes different side effects. For example, there are drugs that causes, we call it alopecia, the hair loss. And basically, we tell the patient maybe they can use alternative ways of, especially women, you know, they love their hair.
Yeah, I do.
Yeah, they can use alternative like wigs, beautiful hair scarves or something. Yeah, but after chemo, the hair grows back.
Grow back. Is that the only side effect to chemo?
Not really. The others like nausea and vomiting, we give what we call the pre-meds to prevent those side effects, and even after we give them the post-meds. That is drugs that maybe can stop the nausea, the vomiting. Yeah.
Okay. And during chemo, when a patient is undergoing chemo,
we also encourage them to use some scientifically proven methods, like the use of ginger, which is scientifically proven to eliminate the side effect of nausea and vomiting.
Now that you've mentioned ginger, do cancer patients during chemotherapy, is there a special diet or nutrition they should observe, or do they continue with their normal feeding habits, or do they take a diet like the one someone who is cancer free will take, especially during the treatment?
Yeah, you still continue with your normal feeding, but if a patient is having some harmful habits, then you tell them to modify. For example, if a patient is alcoholic, they cannot continue with alcohol.
Okay, and can a patient, someone who is doing chemo or someone who is undergoing cancer treatment, can they exercise? Mostly we are told for you to be healthy, exercise and all that. Can they exercise?
Yes, of course.
Oh,
that's part of the treatment also, physical exercise. You know, lying for too long again, if they can tolerate, yes, they go ahead with the exercise. It's equally important. It's part of the treatment.
Now you're telling us that chemo and all these cancer treatments, they depend, or mostly it's going to be determined by what type of cancer it is. Now, this is the Breast Cancer Awareness Month, and this mostly is, we are taking a focus on breast cancer. So for breast cancer, what are the types of breast cancer, and how are these types of breast cancer going to influence their treatment?
Yeah, we have luminal A, we have luminal B, and we have the triple negative. And basically, all the treatment is just different. It's decided by oncologists. Yes.
Could you help us break down the limo A, B, and
that's quite technical when you go down, because the luminal A, they are what we call the tumor markers that are done, and they help the oncologist to decide on what type of treatment that she'll give. For example, the triple negative is treated with chemotherapy. There are the others that need hormonal manipulation, like the hormonal positive breast cancers.
What do you mean when you say hormonal manipulation in
Yes.
layman's language?
Yes, there are hormones that are administered. Yes, they take. There are some that are injected, and there are some that they take orally.
Oh, so basically it's medicine.
Yes, basically it's medicine, but they take tablets.
All right. Thank you so much for making time for us. I think that is it. And if you could just explain before we wind up, radiotherapy. A lot of people don't understand what exactly is radiotherapy. Could you like explain it in words, since we are not in a position to do a demo of the same? What exactly is radiotherapy?
This treatment, these are kind of treatment where they use. It's like the way the X-rays are done. They use the radiation. An area is irradiated, like the way X-rays is done. But then the patient first is reviewed by the radio-oncologist. They go through a process called simulation, and the tumor is irradiated using the radiation treatment. Yes.
And at times, cancer patients will have cancer recurring. It appearing again after treatment, and they were cured, and then it comes back. When it does, is the treatment the same? Is it going to follow the same procedure?
Again, it depends, even with the staging. And as I told you earlier, the chemo treatment, basically their goals of chemotherapy. Why are you giving this chemotherapy? Is the treatment curative? Do you want to palliate? Are you giving it for palliation purposes? And palliation here means that you just giving to make the patient comfortable, not cure, not curative. Yeah.
At what stage is cancer curable?
Yes.
At what stages? We have 0 to 4 stages of cancer. So at what stages can we say that cancer is potentially curable?
In early stages.
In early stages?
Yes.
That would be stage 0
to 2.
Or 0 to 2, which is curable. Okay, what is your word for those who are treating cancer, those people who are living with cancer, maybe it's not even curable? A word of encouragement for them, what do you have to offer here at Outspan to make them?
There is hope. Yes, there is hope. And we say that we have something to offer to this patient as we walk through them that journey of cancer. Even if it doesn't mean whatever the stage it is, there is hope, and there is something we can always do for them. Yes.
Thank you so much. That's where we wrap it up here. And like you've heard, there is hope, and cancer is not equal to death sentence. So it is curable if detected early. And even when it is not curable, it can be managed. There is palliative care. So do not lose hope. Thank you. Thank you so much for making time to watch our very first episode of Medi-Camp. It has been nice having you around. We hope that we have impacted you. See you next Tuesday, same time here at GTN TV, where we will be talking about diabetes.